higher protein, in fact, when fed in an experimental setting, it turns on cancer. It speeds it up. And a lower protein diet doesn't. The additional observation was that the protein that turns it on was the protein of cow's milk, an animal-based protein, the so-called high-quality protein. And so here we had this dilemma, this fact.
I spent almost a decade researching this subject.
From the Hint offices in San Francisco, I'm Kara Goldin.
Every aspect of your metabolic health improves.
Each week, we're talking to innovators and game changers who think outside the box and tackle problems that few address. What does it really take to be unstoppable? Let's find out. Super excited to chat with Dr. Campbell today. Let me just talk about Dr. Campbell and my feelings about this incredible gentleman who will be joining us today. So I remember reading his book, The China Study, many years ago, and his chapter on peanuts and some of the problems that he was seeing in parts of the world, including the Philippines, and how there were many cancers that were showing up there, and the interesting sort of effects of some of the foods that we were encouraging different communities to eat, including low-carb diets and et cetera. So I'm really, really excited to have him here in a little bit. And Dr. Campbell's a PhD, trained at Cornell University, and worked at MIT as a research associate in nutrition, biochemistry, and toxicology. And he also spent many years on the faculty of Virginia Tech's biochemistry and nutrition group before returning to Cornell, where he presently holds an endowed chair at that great institution. So I'm very, very excited to chat with him more about what we'll be learning on not only different types of diets, but also things to be aware of as you start to look at how you get yourself as healthy as possible and try and figure out what's inside a lot of these health studies. Dr. Campbell, thanks so much for coming and joining us today. We're very excited to have you and introduce you to our audience at the Cara Network. The book, The China Study, is truly one of the most influential books on nutrition in my mind, and it really was the most comprehensive look at the relationships between diet and disease. I'd love to hear from you. What was the impetus for you writing it and devoting your time and really your mind to it?
Well, it goes back a long way in a sense. I had been in this business for a long time. In fact, it's been over 60 years, if I can say that,
Wow.
Since I started my research career. So I've had a long career in research, almost all of it, in fact, all of it in academia, doing original research. And I came from a farm milking cows and went away to school to sort of, in a sense, to advance our consumption of more animal-based protein, cow's milk being one of the good sources. And that's where I started. But then I got involved in my research, doing my doctorate, my master's, and so forth. I got involved in the Philippines in a project. We were attempting to make sure that the children there, especially the malnourished children, got the kind of nutrition that I thought was important here. I mean, it wasn't just me, it was all of us. So in the Philippines, I was there, and we're promoting protein, if you will, and that sort of thing, and making sure they got enough food, obviously. But I saw something that was kind of odd. I got the impression that the few families, I should say, the 2 or 3% who were eating levels of protein like we do in the West, their children seemed to be at higher risk for getting this one kind of cancer. Very narrowly focused little idea, was totally anecdotal. I first heard about it from my medical colleague on the golf course, of all things. And so I didn't pay too much attention, but then there was another report came out from using experimental animals sort of showing something like that too. And I said, wait a minute, this is kind of at odds that, high protein maybe, like these two families were consuming, like us, higher protein meant more cancer. That was really a kind of a crazy idea. But it was good enough because we were focused on the idea of making sure they got more protein. And so then I applied for a grant from NIH. That's the leading biomedical research agency, as you may know. I got that grant, and that grant continued for the next 27 years. I kept getting it renewed and renewed and renewed, and we learned a lot of things during those years. Turns out I had to change my mind. Higher protein, in fact, when fed in an experimental setting, it turns on cancer. It speeds it up. And a lower protein diet doesn't. And then the additional observation was that the protein that turns it on was the protein of cow's milk, an animal-based protein, the so-called high-quality protein. And so here we had this dilemma, this fact, that animal protein turns on cancer development, plant protein doesn't, and we could turn cancer on and off. That was another exciting idea, just by nutritional means. No drugs involved. We're only talking about nutrition in this case. That was exciting, and lots of other things over the years we learned, and I published it extensively in the very best scientific journals, and got involved in policy development at the national level and gave testimony before congressional committees, all sorts of things. And so as the time passed, I became more and more enthused about the idea that we didn't really understand nutrition, and we had to do something about that. So I was bouncing around and getting more and more enthusiastic for it, but also discovering there's a lot of resistance to what I was talking about, to say the least. So my wife finally told me one day, especially after the New York Times featured our article, or featured my study in China. Well, let me back to this for a second. So we're doing all this laboratory research, some in humans, not too much. I had this opportunity to go to China to try to sort out why it is that cancer was so common in certain parts of the country and not in others. It was sort of like a localized disease. And so we mounted this big study. It was a really big study, the most comprehensive ever, and with our friends at the University of Oxford in England, as well as my Chinese colleagues. And so we went to China to see, why is cancer so common here and not there, and so forth, for about a dozen different cancers. And we collected blood samples and urine samples and food samples and so forth and so on, and we analyzed them. By that time, I had about 24 laboratories around the world that were involved in some parts of this. And what we ended up with was a huge body of data that the New York Times featured in the early 1990s. It was sort of a cover story in their science section. And that brought a lot of attention to some of the stuff we were doing, and I was claiming that our research is showing that nutrition is important. Food's important, first off. And secondly, animal-based food is not exactly the way to go, even though I had been raised on an animal-based food farm, if you will. And that created a lot of pushback, to say the least, and so forth. And that went on from 1990 until about early 2000s, 2002 or 3. And my wife says, why don't you sit down and write a book? So I did, with our youngest son, who was an actor, actually. He had graduated in theater from Cornell. He was in Chicago on stage. He came back. He's a good writer, good communicator. So we wrote a book called The China Study. That came out in 2005. We were told by the publishers that it probably wouldn't sell unless I put a lot of recipes in there and unless I took out the references that I had. We had 750 references. I wanted to treat the subject professionally. I was not in favor of publishing just a book on whims, in my opinion. I wanted to treat it, from a professional scientific point of view. So I got some pushback on that, and some of the publishing houses didn't want to do it because I wasn't doing what they wanted me to do. So we finally got together with a small outfit in Texas, who let us write the book that I wanted to write. But we all the time warned all the time, you're not going to sell that book. 2,000 or 3,000 copies, maybe you get to 8, 10, that'll be okay. It took off and kept getting better and better. Now we've sold more than 2.5 million. It's been translated into 40 languages.
That's amazing. Congratulations. That's huge.
I've also, since the book came out, I've had more invitations than I can possibly accept to come and speak. And I've given at least 700, I don't know, once we're getting close to 800 lectures in this country and abroad, a lot of places abroad. The idea seems to have taken off, and I know that when I wrote the book, I was pretty confident of what I was saying, of course, but not 100%. You can't do that in science. And so I kind of watched to see what was happening. And what was happened is that as I've gone through these public lectures and been more and more involved, especially with medical schools, I lecture lots of medical schools, I started to come to realize that, the doctors in this country, that are precious citizens who sort of look after our health, they really were not familiar with this idea. Then I come to realize there's something wrong with our system, something at odds, because most doctors weren't familiar with nutrition, and well, it turns out there's no medical school in the country that teaches nutrition. Not like I know it, not even at all. And then as time passed, it became a bigger and bigger story, because the whole medical system and the medical research system, of which I was a part, all of my research, and it was funded rather handsomely, but all of that research came from the NIH. It was all public taxpayer money. None of it came from the corporate sector. And so, as I say, as time passed, the story kept getting bigger and bigger. Now today is really big. And I've come to realize that nutrition is a word. You know that. But in reality, the professionals and the public, of course, not being told by the professionals, the whole concept of nutrition is terribly confusing for a lot of people. All kinds of claims and counterclaims and so forth and so on. And the majority of people surely don't particularly like to have their own diet analyzed, or they're being suggested they're not eating the right thing. So it's become a big issue. Nutrition is, in my view, the most important biomedical science of all, but it's not even listed. In the medical profession, there's about 130 sort of medical specialties, we call them, naming everything from one thing to another. People can, like to ticket out what they diagnose somebody for and that sort of thing. Of the 130, there's not one called nutrition. And so doctors, that's concerned reimbursement too, because they're not able to get reimbursed, to make a living, hardly, talking about something that makes people well. And so what we've really relied on is pills and procedures. Very expensive.
Absolutely.
It's just, and healthcare costs, as you know, is going through the roof, and we're way higher than any other country. And all the while, the general idea is that we get well by making sure we have access to drugs. Cheap drugs, maybe. It's a big sort of discussion in the political arena these days. Get cheap drugs and you'll get better. That's nonsense. That's total garbage. Because we don't need to. We should not be relying on pills and procedures as a means of being well, especially when, now we know, and I've jumped up through a whole lot of hoops here, leaving stuff out, but we now know that what we choose to eat has an amazing effect, far more than I was aware in the beginning of my career, far more than almost anybody else seems to be aware these days. We can use the kind of nutrition I'm talking about not only to prevent future disease problems like heart disease and cancer and diabetes and that sort of thing, but it actually can be used to treat people with existing disease now. Even people already diagnosed and taking a ton of pills and getting the side effects and this and that and probably not getting much benefit in many cases. They were simply to change their diet.
Absolutely. Well, this is a good sort of lead into what I'm seeing, especially in sort of my day job, which is running a beverage company called Hint. But we've really tried to reduce not just sugar in people's diets, but also diet sweeteners. But I'm curious your thought on, so both adults and children are being diagnosed with type 2 diabetes today, and obesity rates are, off the charts. What do you think we're doing wrong as a society?
Well, we're focused on, as I say, number one, we really don't understand nutrition, and so people feel free, to accept advice of all kinds, and there's all kinds of stuff out there. So that's really one of the big issues. That may not sound too exciting for a lot of people, but if we just certainly were able to define what does that word mean, and what kind of foods fit into that category, of good nutrition. So that's point number one. That's really important for the stuff that goes on behind the scenes, like getting doctors trained and, policymakers doing their thing and so forth. But as a general society, I think, I don't know how to answer that question really. I think about a lot the people in the public are subjected basically to all kinds of claims, contradictory claims of one sort or another. And of course, a lot of claims that are made really represent pushback these days. It represents pushback from the industries that are making so gosh darn much money on us. I mean, the food and drug industries, for example, the medical industry, they're making a ton of money, on supposedly treating people. So people from those industries don't like what I'm talking about, I can tell you that for sure. And so they throw out a lot of claims. They distort the message here and there to try to poke fun at it or whatever. And so the public is not getting access to the information that can make themselves well. So I don't know how to answer that question. I thought a lot of be interested in your comments too, but I say I'm actually very much involved in wanted to talk about the Obamacare or the health care program right now, as you know, that's going on.
Yeah, I'd love to hear a comment on Obamacare and just what you're thinking is going to be happening going forward.
Let's say there's two sides to the debate, more or less. Right? There's a group of people in favor of Obamacare and a group of people not in favor. And it's mostly on the political right, political left, more or less. What's really interesting about that debate, or shouting match, maybe I could say, is that neither side have a clue of what really makes for health. I really mean that honestly. They do not have a clue because they're not about to cross the line. I mean, there's a lot of really well-meaning people involved in this, but they don't understand that we can actually do so much for making people well and thereby reduce healthcare costs. Talk all about this huge healthcare cost problem, and it's a huge problem. It's going to break the bank. And then talk about how do you there's sort of talk about who's going to pay the bill in the future. That's what it comes down to, and arguing that ad nauseum about that question in one form or another, trying to save here, save there, or whatever, and they're not talking about the one thing that should be talking about, and that is nutrition. And so I say the government, and I've been very much involved in governmental affairs and political affairs of that sort, I can tell you with a great deal of confidence, the government, knowingly or unknowingly, I think a lot of us knowingly or unknowingly, what they're doing is they're proactively denying this kind of information. That's what they're doing, because they're protecting the industry. They don't want to cross the path of the drug industry or the path of the food industry in large measure, and the whole medical system. So it's a huge problem. I've spent quite a lot of time in Washington and operating sort of to some extent in fairly high levels. I've been on expert panels and and given testimony before congressional committees and that sort of thing. And I have some feel for what's going on. And the politicians are elected, as we know, but they're elected with money. And so whoever has the most money, and that's where the Citizens United case comes in from the Supreme Court some years ago. Now you can spend ungodly amounts of money. People with lots of money are going to spend it. And so we buy politicians. And the politicians, in turn, they're not going to cross the path of the people who paid for their election. I mean, it's very difficult for them to do that. Even the sort of the ones who would be more excited about this idea, they're still hooked to that money chain. And of course,
Absolutely.
people work for them. That's their jobs. So they fall in line, and so you get things like the government, for example, giving us dietary guidelines, as they have been doing for some years. Every 5 years, they come out with a new statement. And the dietary guidelines, what they say, they're very careful. They do a little window dressing around the side. And they'll hint that they know, we should do this, we should do that. And the next round, they pull it back. They don't ever get to the real question. They just don't. Because the dietary guidelines is actually controlled in large measure by the Secretary of Agriculture.
Correct.
And USDA is basically, I should say, it's a livestock-based, animal foods industry-based enterprise. That's where the money is.
Yeah.
And so they're not going to, if it gets to the Secretary's desk, if a committee comes up and they do every committee on this and try to get the science up to date, the committee members themselves, in my experience, are timid because they know that if they go a little bit too far, and most of them really don't quite go where I go, in some cases because they know that it might give them some trouble. And so it just languishes. It just our problems get bigger and bigger and bigger. We're not solving the problem. And what I'm saying, as far as the healthcare debate is concerned, is let's agree that there's a piece missing. It just so happens to be the most important piece of all. It's called nutrition. We've got to be more proactive in describing what does that word mean, why do we say what we say, what's the evidence, and that sort of thing, and get the government out of the business of organizing programs as if they were doing some good, like the subsidy programs we have for subsidizing the production of food we ought to be eating, so that then people get sick, and then we can buy drugs that they ought not to be taken. I mean, so I don't get too excited about the government program in that context. They do some good things, of course. I'm not totally opposed to that, but unfortunately, government programs tend to be eventually co-opted by commercial interests. And so I think what public officials should do, if they're going to be responsible, is just to make sure that there's certain things that we can do, and it doesn't cost much money, to basically inform the public about what is the truth. The government doesn't need to take sides. I'm not saying that. In fact, they shouldn't be taking sides, obviously, but they're using their money, and they should be setting up forums and that sort of thing to inform the public. They should, for example, ensure, before any federal money is made available, they should ensure that medical schools are offering some information in the area. Really big.
Yeah, and I think also, to your point, incenting doctors to actually explain nutrition to their patients, because I think right now I have a few doctors in my family, and speaking to them about the healthcare system and also how insurance works, there's just no time, and there's no incentive for them to actually sit down with a patient and actually understand what they're eating and drinking. And so I think that's also a piece of it too. You also talked about the agriculture side of this big business. And, what I learned in the last few years since running our beverage company, Hint, that the Dairy Association actually controls what actually goes into our school system as it relates to drinks. And so they actually, you may or may not know this, but they actually the Dairy Association wrote the language behind what schools are allowed to put in schools. So the one thing that they put into the rules was that you couldn't have carbonated products in K through 8 schools. And so the reason why they didn't want carbonated products is that they wanted to obviously get more milk into schools. But the language around chocolate milk, for example, in schools was actually not written into those rules. Instead, it was about carbonation. So in our case, we have a carbonated product that doesn't have any sweeteners in it, and we can't go into most K through 8 public schools because the Dairy Association wrote this language, which just makes no sense whatsoever. So it's amazing how many, rules are written by people who have sort of other incentives. And even, just going back to this Obamacare vote today, I don't understand how 8 people last night were on the fence about how they were going to vote this morning and somehow were pushed to, make a decision how they were going to vote. And, are they getting pressure from their constituents who are big lobbyists of some sort, or big business and pharmaceutical companies, or whatever it is. And it's really, really frightening when instead we should be thinking about the consumer and how to actually make them healthy again.
Right. I know there's a situation about the ties between the dairy industry and the school lunch program. The school lunch program actually comes out of the USDA too, and the group does the dietary guidelines. And so, yes, there are, it's not exactly the Dairy Association that makes these determinations. It's the committee and the USDA itself that does those dietary guidelines. But they, in turn, are very much affected by the members of the committees that make these determinations. And what I mean by that, the members of the committees too often have a sort of a personal conflict of interest with the dairy industry. It's just been part of our scenery for decades. And so, yeah, they have a very heavy hand in this. It's not just them, it's others. They're protecting a huge multi-billion-dollar, enterprise. And the way it works is that any school can offer the school lunch program, but the mandate essentially says they have to offer the dairy option. And so the schools don't have to force them to do it. At the local level, that in many cases is really what's happening. At the local level, school administrators and others think that the dairy is really food from heaven and children should need it, and et cetera, et cetera. So there's a lot of pressure that occurs, in the lunchroom, about that sort of thing. And that's just the way it is.
It's interesting. So obviously, we're talking a lot about information that gets to the public, but what do you think is the most crippling misinformation out there when it comes to nutrition?
The low-carb diet, number one. And number two, not necessarily in this order of priority, but that's one thing. The other thing is that the individual nutrients can have an effect. They don't. I'm talking about the nutrient supplement industry. We're now paying over $30 billion a year for that. I've been deeply involved in that from its very beginning, almost. And I was the one that was the principal witness in the Federal Trade Commission hearings back in the 1980s when some of those claims were first being made, so I know that firsthand. And the evidence doesn't show that they work, really, certainly not in the long term. In fact, a lot of those supplements have been shown to actually have the opposite effect from what is intended, which brings me to the sort of scientific point of view, and that is when nutrients are in the form of whole food, they're part of the whole food, they work really well. They do what they're supposed to do. That's part of nature. But when you take them out and put them in a pill, all bets are off. And so we get really very serious problems. And in the larger context, when people would come to believe or think that nutrition is about taking nutrient supplements, for example, they're missing the point. They're missing the boat. It's really whole foods that matters.
Awesome. I totally agree. And I think it's frightening to think that so many of these supplements are not, or the supplement industry as a whole, I should say, is not regulated. So it's very frightening. Well,
they say they're over-regulated, but I don't agree. I agree with you. But
yeah.
Right here.
It's extremely frightening. So what else do you think is really, really critical today? I mean, when we talk about just obviously whole food and plant-based diets, I mean, what do you think people should be focused on, or just saying it another way? I feel like we're living in a society where people want quick fix and quick changes. And whether it's diet or exercise or anything else. I mean, what do you think we can do in just a couple of extra steps in order to get people to change, to sort of, put the work in and actually do the research to actually get healthy versus actually relying on, like you're saying, doctors to medicate or all of these, things that we're doing as a society that are obviously not going right given so many of the diseases that we have today?
Well, in my trade is the role of information education. That was my career, essentially, either creating the right kind of information or, in fact, lecturing and talking and that sort of thing. So it really is about information and getting information to the right people. And as I said before, the government, with little expense, can actually organize, public forums for people to come and participate in them and ask questions. And that should be done on a broad scale across the country. I debate people with opposing points of view because this information sells itself. And incidentally, that brings me to my next point, and that is people want a quick fix. That's very clear. They do. They're looking for magic pills, essentially. They want a quick fix. And somehow they look at food, that can't be it kind of thing. Well, now what we know about nutrition when we do it the right way, and my oldest son has done this, and he directed the film called Plant Pure Nation.
Yep.
And he's sort of doing that. He set up a wonderful program of wellness groups around the country and that sort of thing. My youngest son is a physician. Now he's a director of the first nutrition and medicine program at a major medical school, which is very exciting. And they're both and others. I got colleagues doing the same thing. If you take a group of people, just neighbors, friends, whatever, put them on this kind of food. It's got to be done right, but put them on this just a day's time, 2 weeks' time maximum. They'll see major changes, almost everyone. Cholesterols drop, triglycerides fall, blood pressure problems, if they're there, they begin to resolve themselves. Body weight is another one. They lose a lot of body weight. And so I think demonstration, that's when I say information, one way to educate is let people try this. Just see what happens. No more questions asked. They can decide for themselves. And because the information will sell itself. And so you're getting people informed in that way, getting people informed in other ways, through media or through, something that's responsible and, offered in a responsible way, getting doctors educated. I have to say, incidentally, I'm in one area of our society and the change that I'm beginning to see is in the medical profession. I still view the medical profession as being the profession to take us into the future. They're going to be looking after our health. And so I'm very much a very pro, in essence, a very pro-doctor sort of stance, if you will. I mean, after all, they're the ones that are kind of looking after us, but they need to be educated. And I'm finding out a lot of doctors now, especially the lectures I give, they're really kind of sitting on the edge of the seat and listening. And so I have a great deal of respect for our medical profession. As individuals, I don't have much respect for the institution of which they are a part. So I want to separate the individual from the institution.
I think that makes a lot of sense.
But when they learn, and what this can do, I spoke in, this happened several times, but probably one of the most notable was a couple of 3 years ago or so. I get a standing ovation. I was speaking to a group of 800. I got a standing ovation when I was introduced, let alone when I had finished. So I find that doctors, good people, went away to medical school because they really wanted to help. They wanted to be in a trade that they thought they were doing something really worthwhile. That is their motivation, majority of them, I think. And they just weren't told the right things. Now that some nut comes along, talks like I do, they say, "What are you talking about?" And then they start testing. They try to find out. They're learning. Physicians are learning, what this can do, and they were never taught it. The biggest problem is that physicians are not being reimbursed. That's like you said before. Exactly. The whole system is such they don't have time enough to even spend with the patient. If they were reimbursed for this kind of information, things would change. If they could get reimbursed for this kind of information, things would change. And so, because that's the biggest problem, they have short visits because they've gone through a certain number of patients each day, if you will, in a typical doctor's office. They got to run through a certain number of patients in order to get a halfway decent salary. Otherwise, it's a tough road to travel. And so they need to get reimbursed, and that in turn requires the government taking a look at that in a really good, hard way. For example, establishing a medical specialty in the area of nutrition where they can get reimbursement for this kind of advice and get paid adequately for what they deserve. But that won't happen. I shouldn't say it won't happen, but I like to be an optimist. But I have to tell you, those who control the medical profession, like the pharmaceutical companies and so forth, they don't want this to happen. People come to the office and they want a pill. It's that simple. And if you don't have a pill for them, I hear that from my doctor friends, like my son even, whatever, they come into the office, they want to get fixed, they want a pill right then and there. And they're pretty demanding, to my understanding. And so the visits are short. Let's get on with it. Give me the answer, and we'll go from there. It's not the way it works. And talking about how fast this happens, as I said, 10 to 20 days. They want a quick fix. This is a quick fix. I mean, if 10 days is too long of a period of time, well, maybe there's not too much hope. But we can actually see in a matter of fairly short order, see changes begin to occur really quickly when they do this. Aches and pains of all kinds, other issues that are arising because of their use of drugs, maybe side effects, whatever. So they get into this, they start doing this, they start going off their drugs. Just check that out with some diabetics. Just see what they say. Or check it out with heart disease patients.
I absolutely agree. I think, the challenge is actually blowing the whole system up and getting people to really think about what they're actually doing. I think people are scared, right? And they're not hearing from their doctors, okay, let's try and wean you off of these drugs and let's look at some healthier alternatives. And it really just goes back to, getting these doctors to really advocate for whole foods and trying to see some changes there first. So
that's right.
This is really, really super, super interesting and something that is close to my personal beliefs as well and what we've been trying to advocate in our own product too, that it's really about, getting people to recognize what's inside, in the case of our product, what's inside the bottle, instead of focusing on all of these health benefits. That what's really interesting to me when I think about, a lot of these food and beverage companies and I talk to consumers, I look at words like diet and vitamin and antioxidants and electrolytes and lots of, words that I think have really tricked consumers into believing that they're healthier than they are. And at the end of the day, those same people, are shopping at places like Whole Foods and Trader Joe's and trying to do the right thing to make themselves and their families healthier. But at the end of the day, they're just being fooled by lots of words that really, for whatever reason, the brain actually equates to health. So I think if we can start to get this all consumers focused on what is really healthy and what is not, and starting with Whole Foods is such a great segue into trying to get as healthy as possible. But, well, this has been really, really great, Dr. Campbell. I so much appreciate you taking the time, and we'd love to stay in touch with you and potentially get you back on here as we start to look at what happens with Obamacare. And if you'd be open to that, we'd be really, really excited to talk to you more.
I'm trying to stay close to it, put my toe in the water on that in a pretty big way if I can. And can I mention just a couple of things? This sounds commercial, and if I shouldn't say it, well, then you can cut it out. But, we have a nonprofit organization called Nutrition Studies. It's actually my name, T. Colin Campbell, Nutrition Studies. But the URL is nutritionstudies.org, and what we have is an online program on plant-based nutrition. It's and our partners, Cornell University's online, and I don't get a cent out of that. I get no pay, so that's why I want to put that in there so it's not misunderstood. It's not a money-making proposition for me, for sure. But we have that program. People can go and take the course. Doctors can get 30 credits of continuing medical education credits, and so we have a lot of those kind of people taking a course too. And so that's one thing, and we're very excited about that. We just now, as of next week, I think it's going to be, yes. It's all been translated. Our entire website and the whole course have been translated into Spanish for the Spanish-speaking world. And I know the Chinese, just this morning, I got a phone call from my friend in China. They wanted to do the same thing. And I think, getting information out there, and as I say, we're doing what we're doing. And we've had about 9,000 graduates that get a certificate for taking the course. Another son, again, here I'm focusing on my family, so I apologize for it.
No, we love it. This is great.
Well, in any case, the older son, who was the director of the new film called Plant Pure Nation, you can get it on Netflix. Take a look at that. Take a look at the other film, too, that preceded it, Forks Over Knives, which started with the China study. Those films, Forks Over Knives, Plant Pure Nation. Well, in the case of Plant Pure Nation, that's the more recent one. That was a film concerned with why haven't we heard this before kind of thing. And it started with my presentation, along with my colleague, Dr. Caldwell Esselstyn, our presentations on the floor of the Kentucky legislature. That was all filmed. And then the story goes on from there. So people can watch those two films, for one thing. But in that effort, the Plant Pure Nation thing, my son has about 450 wellness groups around this country and about 11 other countries now. with all networks, internet, and they're all doing something to, promote this idea. I'm excited about that. And then he has a line of food, frozen food, and that Amazon has just bought into, and Amazon has just launched his line. So we're getting some pretty big players involved in this.
That's great. What's the name of the food?
You have to go to the website plantpurenation.com.
Okay.
Go there, and you'll see in there how it's all connected. I can't even give you the details because I don't necessarily know them. But to go there, they'll see what's going on. Amazon, as I say, has gotten excited about this, I guess, and they're partnering with us, with my son. And those kind of things are happening where people with that kind of food is meant to be affordable, efficacious. In other words, it works. Affordable, efficacious, and tasty. 3 big things.
That's terrific.
If it fails in any of those 3, it's not going to go. And again, I don't get a dime out of that. I have no investment in it, so I do have to add that qualifier to get away with what I'm saying, I guess.
No, this is terrific. I really, really appreciate it. Well, thanks again, and have a great rest of the week.
Well, thank you for the invitation. I enjoyed it.
It was so nice to meet you.
Okay.
Thank you. Bye-bye.
Bye-bye.
You can learn more about Dr. Campbell and all of his nutrition studies at nutritionstudies.org. Thanks so much for listening to Unstoppable. If you like what you heard, please help spread the word and leave us a review. You can also follow along with me on Facebook, Instagram, Twitter, and LinkedIn at Kara Goldin. Do you have a question for me or want to nominate an innovator to spotlight? Please talk to me at karagoldin.com. Until next time, be unstoppable.
Addictive nature of modern food.
Nutrition is important.
Obesity and diabetes epidemic.